You take a seat over there, and I think you're on a handheld microphone there as well. Whichever one you like. Grab a microphone. So I thought we could focus this particular discussion on looking at the three big visionary goals for the global roadmap for meningitis. So that's eliminating epidemics of bacterial meningitis, reducing the number of cases and deaths, and then also looking at reducing, rather improving quality of life in the aftermath of it. So on the eliminating epidemics, 2030 is only, well, less than 6 years away. We've heard that it can be done. Do you believe that it can be done?
Absolutely, yes. It can be done.
Good answer. Okay, good answer.
I think you have already stated the visionary goals, the three. And we have also strategic goals, 5 pillars in the roadmap. But there is something that gives hope. I think everybody has read that, so I don't want to repeat that. Especially with the vaccine. As you know, this was 13 years in the making. Indian Serum Institute and PATH. Then on July 2023, WHO pre-qualified the vaccine. And that was, by the way, for me, the happiest moment, together with the I think September or October, Kate can remind me the SAGE recommendation. I was so happy because I know what meningitis means. Because Ethiopia is one of the countries, the 26 countries in the meningitis belt. And then, of course, the SAGE recommendation was followed by Gavi's resource mobilization. In December 2023. And then, of course, by, I think, February, March, vaccines were moving, early 2024. And as you know, Nigeria has become now the first to use the MEN 5CB. It's affordable, and it's, of course, a tool that is really can make a difference. And that's why I have hope in that. And also the mobilization of all the institutions which I have told you, plus UNICEF and others. And I think I would like to thank President Macron and Minister Frederick and also Pasteur Institute for hosting us here. It's a matter of now all of us together to use the opportunity and eliminate epidemic meningitis. And I believe it's doable. So from Nigeria, now we will move into Niger, and then, of course, we'll focus on the 26 countries and beyond. So I'm really hopeful, and I'm a very, very happy man, actually, since I started, especially the vaccine rolling. Of course, vaccine is one. We have to do the early detection and treatment. We have to do the surveillance, and we have to do, taking care of people who need care, and we have to do the advocacy in order to mobilize. So this has become actually everybody's business and prevent the preventable deaths and disability.
I know another of the sort of topics that gets you quite fired up is universal health coverage, SDG 3. Obviously, we're looking at 2030 for that as well. And UHC is an absolute, the pivotal point of the SDG 3, good health and well-being. How does beating meningitis or tackling meningitis play into that ultimate goal of universal health coverage?
Yeah, it's, as you know, annually 2.5 million, more than 2.5 million cases, and as Minister said, more than 230,000 deaths. This is significant. And the main focus of the SDGs is to reduce preventable deaths and disease. And this is a major disease that kills and also disables. So whatever we do should be part of the UHC, especially part of the primary health care. By the way, the 5 pillars especially can be done better if they're integrated in the primary health care. So what we're saying is meningitis, the fight can bring opportunities to the primary health care, and the primary health care will be an opportunity for meningitis, meaning it has to be integral part of what we do, and it can help us to achieve the UHC goals of the SDG.
Public and private partnerships are also something that you've spoken about at length in the past before. We're going to have a big discussion later about sort of the multi-stakeholder nature of this effort to defeat meningitis. But what would you say to sort of the partners in the room today about the momentum needed in those partnerships to work together in order to actually deliver on this goal?
Yeah, I think to all partners, now is the time. I think we have been working together to make this happen, and we have clear visionary goals, clear strategic goals, clear roadmap, and we know what we want, and we know how to achieve it. So my message is, now is the time to hit hard and make a difference, and you know, by 2023 to achieve the goals we have set in terms of elimination, in terms of reducing disease and death, and I believe it's doable. So that's the message I have. Let's be more aggressive, and as we have done, let's stay united and push. And the private sector, by the way, on the SDGs cannot be achieved, not only just meningitis, all the goals we have cannot be achieved without the partnership of governments, civil society, the private sector, the academic institutions, NGOs, foundations, and all players. So we have to continue to work together.
The third visionary goal for this global roadmap is about improving quality of life and reducing disabilities in the aftermath of meningitis. Paris is, of course, playing such a massive role this summer with the Olympics and the Paralympics as well. How important do you think sport is in raising awareness of not only deadly diseases, but also debilitating diseases, and how to not only, you know, survive, but thrive in the aftermath?
Yeah. As part of our WHO transformation, by the way, partnership is central, one of the thematic areas we have identified. And it's because of the partnership now we have established the Civil Society Commission and the Youth Council, but partnership is beyond. And we have also decided to partner with you know, sport institutions like FIFA, for instance. We signed agreement in 2019 for the first time. And ever since, we worked very closely together. In 2020, we signed agreement with International Olympic Committee. In 2021, with Paralympics. So we have relationship with all of them. And especially with Paris Olympic, IOC and Paralympics are central. And we have already an agreement, and we have been in partnership. And we will use the Paris Olympic actually to increase awareness, what meningitis means. But not only that, to mobilize support. But at the same time, of course, in Paralympics, many who have been affected by meningitis will participate. And to show that this ability is another type of ability, as they say. And I heard a quote, I think, from Andrea, who was affected by meningitis, who says, the limits are actually in our mind. And I think we can use that platform to reach billions. And that's why, by the way, we started the relationship with all the important global institutions, and we work very closely with all three. And this platform, not only for meningitis, by the way, we will use it to fight non-communicable diseases, to fight other major diseases as well. And looking forward to the Paris Olympic. I will be here. I have already confirmed my participation to Thomas Bach, and he's expecting me. And look forward to using that opportunity actually to invest in the fight against meningitis, and look forward to it.
Well, we're so thrilled that you have found the time to be with us here today, so thank you very, very much,
Thank
Dr.
you,
Tedros.
Hannah. Thank you. Very nice meet again. Thank you.
Thank you. Well, a very big thank you again to DG Tedros. So a key element of today's meeting is, of course, the launch of the investment case as well. So to learn more about that and learn more specifically about this,